Living with nephrobromatosis is hard, the way the people look at you and the way they perceive you. But I sort of ignore them because they the ones with the problems, not me. You could have a disease, but you don't have to be the disease.
I was first diagnosed with NF when I was a toddler. Living in Virginia Beach, there were no NF specialists or sarcoma specialists in the area, and we somehow just stumbled upon Johns Hopkins and the NF program here. And as soon as I came here and I met Dr. Blakeley, I just knew that this was the place I wanted to be.
I first became involved with the Children's Tumor Foundation by attending their conference in 2007, and I knew very little about NF at all, so that was my first education in how to take care of patients with NF1, NF2, and schwannomatosis. And through that interaction, I formed some collaborations that led to a clinical trial for patients with NF2, and Children's Tumor Foundation funded that clinical trial, which we've now completed, looking at drugs for vestibular schwannomas.
I honestly don't think I would still be here if it weren't for Dr. Blakeley, because this cancer is so aggressive, and I've been fighting it for 2.5 years now. And I know that wouldn't be the case if it weren't for Dr. Blakeley and her team.
At one point I was feeling like there was something wrong with me, that I was a monster, but she had taught me how to accept myself. She's very patient, and she's willing to find ways and means to try to get her patient to feel comfortable and to understand their disease.
Dr. Blakeley is just amazing. The way that she spends time with you. From my very first appointment, she just made me instantly feel very comfortable with her.
I stayed involved with the Children's Tumor Foundation because they are the leaders in the research that's going on, and I serve on the medical advisory board for the Children's Tumor Foundation because the directions that they set in terms of where research should be going and where advocacy should be going, I think are the right priorities.
I just don't know anyone who is as kind and compassionate as she is. Honestly, I feel like I owe her my life.
I think the future for NF research is very bright. In fact, I think we're on the launch pad now, seeing many things taking off, especially in NF1 and NF2. We are seeing clinical trials with drugs that are helping patients in real time. Right now, these drugs are making patients better. And we are actually seeing the potential that we will have multiple different treatments that address the range of symptoms and presentations that patients with NF1 and NF2 have.